released today information about a new label change. We're going to approve a treatment for kids with severe autism that have an antibody or a deficiency of folic acid in the brain. Maybe 20 to 50 or 60% of all the kids with autism have a blocked receptor in their brain that's not allowing their folate, that is their vitamin B9, to get in the brain and for those nerve cells to develop normally. And this medication, leucovorin, bypasses that receptor. And there are incredible stories from doctors of seeing dramatic improvement. So we've got good news and we've got this warning.
So leucovorin is the name of
yes.
And once Marty changes the label, which will happen in a few weeks, then we can actually have state Medicaid and CHIP programs pay for it. That means all moms in America, even if you're having financial distress, your doctor who's able to prescribe prescription leucovorin will get you the medication that you might need for your child. This is, again, the president and the secretary thinking big, making not only changes to labels of medications that might actually treat the ailment, doing research and releasing studies that wouldn't be done before, but then making it affordable for America.
Well, this could potentially be huge. It doesn't surprise you, I'm always going to ask a tough question. You're getting hit because you're on a global advisor for iHerb, that, and obviously leucovorin is a drug that is it iHerb? Who's telling?
But yeah, but
you're a global advisor.
Yeah, but I'm just saying they don't sell this product.
Folic acid.
Yeah, the prescription, what we talked about today was, first of all, I divested from that company, obviously. It's
but you still have an equity stake in the company.
No, I sold everything.
You got nothing?
Nothing. You have to. You can. That's not.
Well, what are they?
I don't know. It's manufactured. It's just news.
Yeah, you have to sell everything when you work for the government, right?
But the bigger story is that they don't sell prescription medications like leucovorin at that company. Leucovorin you have to get from a doctor's prescription, and there are pharmaceutical companies that make the product. It's safe, high dose when used appropriately. Which is, again, what Marty did was tell American women that although you think you've got no medical options, for the first time ever, you now have one. And it's, again, you got to talk to your doctor about it, and we're going to study the results of what happens when you give it to your kids. But we are hopeful from the data that's limited that we've seen so far. But I called around, talked to a bunch of doctors taking care of autistic kids. Every one of them, with one exception, told me they would give it to their kid right now if the child was autistic.
And this drug is very safe.
It's been around a century, an amazing safety profile.
What's the difference between that? This is a really dumb question, but folic acid, is it related? Is it any relation to it?
We want people to take methylated folate. That's the type that goes indirectly in and bypasses the receptor.
Folic acid, which you fortify foods with, it's very different from what the brain needs, which is what Marty says. And the best way to get it into the brains of children who have autism is folic acid. But again, it's a prescription drug. You don't have to memorize that. Just ask your doctor, if this is an option for you, because I think a lot of doctors have had their eyes open today.
Well.